Okay, well, this is Jim with Life Priorities, where we study the question, what are our core priorities and how do we become more effective at it? And one of the best ways we become effective at our priorities is to find people who can guide us in the areas that we need help in. Because you know what? We can't spend enough time in each of our priorities to learn how to be expert at them. We have an expert in here today on telemedicine. And basically, he's a doctor who knows what he's talking about. And most people, health is one of their priorities because obviously that affects everything you do. So I've asked Dr. Chuck Goldberg to give us some time today. He's agreed to that. I'm very excited about it. Dr. Chuck is a fabulous doctor. And I'm going to have to read his credentials. He has so many of them. It would take me an hour to tell you all of them. But he's the founder and CEO of Better Life Northwest and Better Life Southwest, and also Medicus Bioscience Research. That's a medical research institution investigating optimal health, which of course is important to me. We want to be as healthy as we can, even though we might not be perfect. If you can get as healthy as you can be as effective as you can. Dr. Goldberg has 40 years in practice. He's had over 350,000 patient visits. Right now he is set up and is running a holistic medical clinic, and he is a pioneer in telemedicine. Now, I don't know about you, but I didn't know much about telemedicine until recently. I know it's a wave of the future. I don't understand how it works, and that's why we have Dr. Chuck on. And Dr. Chuck, I'm very excited to have you here today. Just wanted to ask you a few questions just to give us a background on how telemedicine works and how it can work for us. So thank you for being here.
My pleasure, Jim.
I think my first question really is, what is telemedicine and how does it benefit us?
Telemedicine, very briefly, is the ability to see your doctor without having to physically leave where you are at the time you're seeing him. Most people that I work with in telemedicine are at their home when the visit is conducted. It can be done completely audio, or we can do audio and visual as well, using applications that are very simple, either to acquire or to purchase if those are necessary.
Well, telemedicine sounds great to me because it's such a pain to have to spend the time sometimes just to drive there, sit in a waiting room, do a 20-minute evaluation, drive home. I mean, you have to take a half day off work just to do that. And that's why telemedicine to me is so exciting, because health is so important to us. But a lot of people, I think, skip going to the doctor just because of the time involved. And sometimes the money, but mostly the time. Are there any inherent risks in not seeing a doctor face-to-face?
There are some, but if it's done properly, I think those are minimized. You hit some real important points in your introduction to this question, Jim. Chief among them are, yes, it's expensive, and yes, it takes a lot of time. In a lot of situations, we don't consider how much time it takes to do anything, let alone go to the doctor. But when we did the research on this, typically a patient was taking 20 to 30 minutes to travel each way to the doctor's office. Even if I was spot on time, maybe 20 to 30 minutes. So that's an hour and a half out of a person's day, okay? Let alone the cost and the wear and tear and the stress of driving in traffic and certain times of day, that kind of thing. So we can cut that hour and a half down to about 15 to 30 minutes maximum with a telemedicine visit, and eliminate completely all expenses except the expense of the visit. Inherent risks in terms of not being face-to-face is if I don't know the patient doesn't know me. So I reserve telemedicine exclusively for people who I have seen at least once on a face-to-face basis and have a baseline set of data for them. Now, in the emergency situation, obviously I haven't seen them. We will have a follow-up appointment where we can meet physically face-to-face. The only place that doesn't work well is if, as you know, I have offices in Phoenix and in Portland. If I'm in one place and the patient's in the other, then we'll try to do it like this, which is very close to face-to-face.
Well, what symptoms or conditions are best served by telemedicine? Are there some that are good and some that are not so good?
Yeah, chronic cases, chronic situations where monitoring is needed, like hypertension, cholesterol problems, diabetes, other heart diseases, those kinds of things really lend themselves well. But some acute medicine does too, because since, as you can see, we're looking at each other right now face to face. If you are on your cell phone or even on a computer in most cases, there are applications that will allow me to do a complete eye, ear, nose, and throat examination. And with a cell phone, there are apps that allow me to do a stethoscopic examination. And we even now have applications where I can do an electrocardiogram and an X-ray or an ultrasound.
Wow. Well, should the doctor I pick for my telemedicine be someone in my general location so that I can see him face to face? occasionally, or does it matter?
That's optimal, but it doesn't have to be.
So do patients normally see the same physician over and over again on telemedicine, or is it handled by a team of doctors?
That's a great question, and the answer is yes to both ways. I prefer to have a doctor-patient relationship that's ongoing, but a lot of telemedicine sites seem to work well with random choice of doctor.
Depending on, I guess, the condition the person has.
Right.
Now, can a telemedicine doctor prescribe prescriptions?
Yes. In most cases, yes. Certainly in their state, and some of the larger telemedicine companies have blanket sanctions so that the doctors can prescribe out of state.
And do telemedicine doctors take insurance or Medicare?
Yes, yeah. A couple of years ago, the Congress of the United States approved payment for telemedicine.
Oh, so we can use our insurance. So it's the same as going to the doctor in an office.
Right. Yeah, just have to use the special codes, which I don't have memorized, but there are special codes.
Now, how do we go about locating a qualified telemedicine doctor in our area, especially if we want to see him face to face?
Sure. If you have a physician now, primary care or other, ask them if they do telemedicine. If they don't, I'm happy to coach them to it because I like patients to stay with the doctors they're familiar with. If you don't, or a person doesn't have a telemedicine doctor, I'd prefer, Jim, if it works out for you, to talk with that person individually so I can find one for them.
Well, how do these people get in touch with you, Chuck?
Through you, I can give you a number where they can access me.
Okay, that's great. Well, I sure appreciate your time. I didn't want to take a lot of it. I know your time's important. You're doing some great things. I know you have a holistic clinic that you've started up and are running. And I think that's totally awesome because I think that's where medicine needs to head. And that is fixing problems before they happen rather than wait until symptoms occur and trying to hide them. So anyways, I really appreciate what you do, doctor. And if anybody has any questions, they give me a call and I'll give them your number.
Thank you. Good being with you, Jim.
Thank you. Bye now.